Full committee, Mr. Walden, 5 minutes for questions, please.
Well, thank you.
For opening statement, please.
Yeah, thank you. Thank you, Mr. Chairman. I appreciate it, and I appreciate concerns of my colleagues. I would note from the record, there have been multiple pieces of legislation since Obamacare was enacted that have received Democrat and Republican votes, and actually signed by the President to repeal problems in Obamacare. Those became law. So to argue that nothing's ever been done to try and straighten it out is false. I think Democrats combined cast 4,775 votes to repeal, to reform, to change Obamacare. So check the facts. We're here today. We know on our side we're going to repeal Obamacare. It's not working. It's left a lot of wreckage around. We're here to clean it up. And in fact, we are wide open to hearing from our colleagues on policy. That's what we're about. We know Obamacare has what it's done to the healthcare system. It's why we're hard at work crafting reconciliation language to repeal it. But today we begin the important work of laying the foundation to rebuild America's healthcare markets as we dismantle Obamacare. We have to save this individual healthcare insurance market. It is collapsing. And if you want to walk away and just let it collapse, a puck's on your side. That's not what I'm about. I've always been a problem solver. You'll hear us in a minute talk about bipartisan legislation, go after those who try and corner certain markets, drive up costs, things like EpiPen. I'm happy to work with you, but it has to be something that can move this forward and take care of people. There's no shortage of evidence that patients and families are hurting under the overwhelming weight of Obamacare. Patients in 21 states have seen average premium increases of 25% or more this year. People in 7 states will experience premium increases of 50% or more. That's not sustainable. In 2016, there were 225 counties across America that had just one insurance choice in the market, just one on the exchange. This year, that number has climbed to 1,022 counties with just one insurer. That's a third of the entire number of counties in the country, a third. 5 entire states now, patients there have just one choice. And if you focus on what those plans are saying, they're evaluating right now whether they can even stay in these markets in the outlying years because of what is coming in existing law passed in a partisan manner by Democrats. Over 5 of the original 23 insurance co-ops remain in business. 5 of 23. They tried it, it didn't work. 2 of those failed co-ops are, sadly, in my own state of Oregon, and we're pretty progressive about trying new things, and a lot of it's worked. These did not. We have the responsibility to prevent a real train wreck for millions of Americans. Not only can we solve this problem, but we must solve this problem. It's time to end the partisan rhetoric and actually come to the table and solve these problems, and I commend my colleagues on both sides of the aisle who are willing to do that. The proposals before us today close enrollment gaps, protect taxpayers, and give patients cost relief. The first 3 bills should come as no surprise. They were introduced last Congress and were the topic of 2 hearings in this subcommittee. The other proposal is equally important to all of us. We will ensure patients with pre-existing conditions will always have access to coverage and care, period. To take this a step further, we've included a placeholder, as all of you have sort of referenced in your testimony, and I appreciate your testimony. Everybody's got a different view of this. We want to get it right. That's why there's placeholder language. Our Better Way agenda envisions a new patient protection in the individual market for helping patients keep health coverage. HIPAA, Medicare Part B, Medicare Part D can serve as guidance for the Congress as we consider how best to achieve the goals of protecting America's sickest patients and maintaining market stability. We can do both without Obamacare's unpopular individual mandate where all these carve-outs have occurred. We've got the best minds focused on helping us, including our witnesses today. We're going to get this right. We're going to take the time to get this right. That's why you see a placeholder language in the draft. And my colleague Susan Brooks is championing these efforts. And I'd actually like to yield her a few minutes for remarks at this time, and then I'll conclude with one other announcement.
Thank you, Mr. Chairman. Yes, I agree. We all agree we have to save the individual market. Yet we all know current law requires individuals to buy government-dictated insurance. Instead, we propose giving people freedom from this mandate. It's only fair. Continuous coverage isn't a new idea. It's been discussed by reputable public policy organizations like the Economic and Political Freedom Centered Hoover Institution, Free Enterprise Focused American Enterprise Institute, and others. We don't pretend that this is the only solution, but we're confident that continuous coverage provides promise. That's why it's part of our Better Way plan, a fairness agenda for helping patients get relief. And today, this placeholder provides the clearest signal yet that we're working with patients and healthcare groups to draft language that balances important health status protections with necessary risk mitigation tools. I look forward to the panelists' expert feedback today on the value of how this idea might help patients get and keep health coverage. And with that, I yield back.
Mr. Chairman, if I could just conclude. While I know our focus today is on insurance reforms, we're also working in other areas of health care to bring relief to patients. Next week, we will take up legislation sponsored by Representatives Bilirakis and Schrader, bipartisan bill that would incentivize generic drug development and increase competition in the market. And for those in the industry who think it's okay to corner a market and drive up prices and rip off consumers, know that your days are numbered. President Trump made it clear in the White House meeting I attended with him and Vice President Pence, he wants competition that will bring lower drug prices, and that's precisely what this measure will help accomplish. Patients are tired of waiting for relief. We're going to move forward in a bipartisan way to give them help. It's an important first step. It needs to happen now. Specifically, the bill would require FDA to prioritize and expedite the review of generic applications for drug products that are currently in shortage or where there are few manufacturers on the market. We all remember recent situations where bad actors jacked up the price of older, off-patient drugs because there was no competition. We want to make sure that does not happen again. This bill would also increase transparency around the current generic backlog at FDA. And while progress has been made, there is still an unacceptably high number of generic drug applications sitting at the Food and Drug Administration that, if and when approved, could bring additional lower-cost alternatives to patients. Whether it's examples like Daraprim or EpiPen, patients need solutions. I believe this bipartisan bill gives us a new tool to fight back on their behalf. I thank you for the indulgence of the committee, and I yield back the balance of my time.
Chair thanks the gentleman. Chair recognizes the gentleman from New Jersey, Mr.